Well, it is 12 o'clock. We will get started. We're going to cover a lot of information today. It will be from a high level of Medicare, and hopefully you will be able to pick out the things and how they apply to you. I'll try to stop periodically to make sure I'm not missing any questions. Don't be shy if you do have any. Chances are pretty good it would be something that I'll be covering further down in the presentation as well. But we'll be talking about it from a pretty high level, and only get into a few of the minute details with the presentation as well. Okay, so with that, I want to first talk about what is Medicare so that people have a clear understanding that it is health insurance that is offered through the federal government that is available to you when you turn 65. People also become eligible for Medicare by reason of disability. So they may have end-stage renal disease or other disabilities that qualify them. If an individual is receiving a Social Security disability check, once they receive that for 24 months, they are eligible to start Medicare. You would automatically receive your Medicare card 3 months before your 24th month of disability. Okay, so we're going to focus today mostly on the turning 65 Medicare eligibility rules, but Medicare in general applies the same way to anyone who is eligible. Okay. Now, I also always like to define for people Medicare versus Medicaid because this can be confusing. When you are turning 65, you are qualifying for Medicare. Okay. Medicare is not income or asset based to qualify. It's social insurance. There are parts of it where you might qualify due to working years, that type of thing will affect the cost, but it is not income or asset based. Medicaid, think of it this way, it is aid for people who lack resource levels and income. Okay, so it's a social welfare program. Okay, people may be eligible for both Medicare and Medicaid at the same time. And then there are special programs for them to enroll in to receive extra benefits. Okay. So we have Medicaid, we have Medicare. Our focus today will be Medicare. Okay. All right. So original Medicare is Part A and Part B of Medicare. Part A is where your hospital costs are covered, and it will cost you $0 as long as you have worked paying your Medicare taxes for at least 40 quarters or 10 years. Okay, so premium is in general no cost for most individuals. Social Security will determine if you have your qualifying quarters. Now, if you were to have a claim, however, and you go to the hospital, you will still incur costs. So zero premium, but if you're admitted to the hospital, you will pay the first $1,736 for a stay in the hospital. That will cover you for anywhere from 1 to 60 days. When you hit day 61, you start paying a per day price, and that per day cost is $434 a day. Then it becomes $868 a day for days 91 through 150, and those days are referred to as lifetime reserve days. So you only get those extra 60 days one time in your life. They will work very hard to get you out of the hospital by day 90. Now, under Part A, the average length of stay in a hospital is actually for 3 nights. So if you were admitted for 3 nights, you would have a cost of $1,736. And the reason we see that as the average length of stay is because if you need some skilled nursing and you go directly from the hospital to a skilled nursing facility, Medicare will potentially cover 100 days. Now, the first 20 days are covered very well and you have no cost to yourself. However, days 21 through 100 have a cost of roughly $220 a day. Medicare is not designed to cover chronic long-term care needs. So if you need to be in the skilled nursing facility for a long time, maybe you've had a stroke, you go there, they think that everything's going fine with rehab and it plateaus, that would not be covered by Medicare. Okay, these are acute nursing care needs. Part A does cover hospice care and covers it very well. And Part A covers blood as far as transfusions, but you have to pay for the first 3 pints of blood every year. Okay, so this is all part of original Medicare Part A. You pay 0 for it as long as you have your qualifying quarters. Your Part B is the other portion of original Medicare. Part B covers your doctors and outpatient procedures. Okay, so your primary doctors, your specialist doctors, maybe a knee replacement or a rotator cuff surgery, covers all types of therapies. So if you have physical therapy or occupational therapy, immunotherapy or chemotherapy, that is all under Part B. Okay, now Part B, majority of the population will pay $202.90. That is the 2026 premium. That amount of money you are either billed or it will come out of your Social Security. Okay. If you are taking a Social Security check, it automatically comes out of that check. If you are not, they will bill you on a quarterly basis, and that bill comes from Social Security. Now, there are times when that Part B premium will be higher, and that would be because of an income-related monthly adjustment amount. They call that IRMA. So for an individual, if 2 years ago, we're in 2026, if you were looking at 2024, if 2 years ago for an individual, your modified adjusted gross income was above 109,000, or as a joint tax filer, if it is above 218,000, you will receive a letter from Social Security that they have verified your income with the IRS, and you will pay more than the $202.90 for your Part B premium. There is a graduated chart depending on your income. So if you find yourself in that situation, they will send you a letter and let you know what that will be. We do have that available. If anyone needs that, I'll be providing our email address. We're happy to send that to you. You can also find the information on medicare.gov or socialsecurity.gov. Okay. Now, as far as claims for Part B, where your medical insurance is taken care of, you would pay the first $283. That is your deductible. That is an annual deductible. Once you pay that, Medicare begins paying 80% of your claims, and you are responsible for 20% of the claims. These will all be based on Medicare negotiated rates. Now, under Part B, there is no maximum out-of-pocket limit. Just like Part A, you could pay these numbers indefinitely. There is no cap or maximum out-of-pocket limit to what you are responsible for. Okay, and we will talk in a few slides down the road here about options to help pay for this or create a limit for you. But this is considered original Medicare. Now, under Part B, there is a possible penalty that can occur. That would be 10% of the premium for each 12-month period that you go without Part B, and you should have picked it up. Now, if you are still covered by an employer plan, you will avoid the Part B penalty. Okay, so if you have employer coverage of any kind, you do not have to worry about the Part B penalty, but you will want to make sure that you pick up Part B when required if you're retiring or leaving that coverage. And we'll go into timelines here in a little bit. So just know Part A, Part B, that is original Medicare. When you decide to leave your employment, if you are of age for Medicare and eligible, you must pick up Part A and B to have full coverage. Okay. All right. So how do you enroll in your Part A and B benefits? That application is done through the Social Security Department. You can apply online. You can also set up an appointment at the office. You would want to call ahead and set that up. or you can set up a phone appointment with them. I will tell you when you call, they will try to only do phone appointments, and they are about 40 days out on those appointments. So it's very important that you work ahead and think about your timeline when you want to transition to Medicare, okay? And again, we'll go over the specifics on the timeline here shortly. Now, Social Security, they will submit your data then to Medicare after they verify if you have your 40 credits and if you are going to be eligible for your A and B. The eligibility is based on age or loss of employer coverage. So if it's loss of employer coverage, there will be certain forms that get filled out for you to prove you're over 65, but you've had qualifying coverage. You cannot apply more than 3 months in advance for your Part A or B, okay? So, if you are turning 65 in October of this year, you are way too early to be applying, okay? So it has to be within 3 months. Now, if you are taking Social Security, you will be passively enrolled into your Medicare A and B. So let's say you retire and you start your Social Security at age 63. 3 months before the month of your 65th birthday, you will receive your Medicare card in the mail automatically. So they call that passive enrollment. So if that applies to you, make sure you are opening your mail. Pay attention because it does come as kind of a nondescript envelope for you. Okay. So keep in mind, enrollment for A and B is done through Social Security, and then they send your data on to Medicare.gov. I would encourage all of you to set up an SSA.gov account. If you have not already done that, even if you're not retiring for a few more years, set up that SSA.gov account. Know what your login information is, okay? Now, here are some tips. You don't need to sign up for A or B if you are still employed with a company, they have 20 or more employees, and you are contributing to a house savings account and you want to continue contributing. Okay, the reason for that is once you have Part A, your HSA contributions are affected. So don't sign up for A or B if this scenario applies to you. Now, you may only want to sign up for Part A if you are still working, your employer has more than 20 employees, but you're not contributing to a health savings account. Maybe you're on a plan that offers co-pays when you go to a doctor. If there are more than 20 employees, just sign up for Part A only. It would be a secondary payer if you had a hospitalization. Okay? Now, you do have to sign up for A and B if you're retired and you're turning 65, okay? So if you're already retired, you will have to pick up Part A and B. Now, if you are 65 or over and retiring, so maybe you've waited until age 67, you will need to pick up A and B to have full coverage. If you are still employed and the employer has fewer than 20 employees, in those scenarios, you have to pick up A and B because it becomes your primary payer. Now, if you are part of an employer group that maybe you have fewer than 20 employees, but your health benefits are offered through, say, a trust or some sort of group where they've pulled together multiple employers, then you need to check with your benefits administrator because you may be considered over 20 employees, okay? But if you are definitely fewer than 20 employees, then you would need to have your A and B coverage. Now, if you are under 65 and you are eligible for Medicare due to disability, the primary secondary payer laws apply at 100 employees, okay? So if you're under 65, you're eligible due to disability, but the employer has fewer than 100 employees, then you would need to pick up A and B in order to have your claims addressed properly. Otherwise, you become eligible or the 80% that Medicare would pay, you would have to be responsible for paying that. Okay. So keep those rules in mind, who pays first if you do pick up A and B, and whether or not you do need to pick it up. Okay. Especially say, in this scenario here, if you picked up B, you might be paying that Part B premium and hardly having anything covered until you would retire. So there wouldn't be a reason to be paying that Part B premium. Okay. I'm not seeing any questions yet, but I'll keep an eye there on the chat box or the Q&A. Now, I want to explain a little more about Part A and HSA. Basically, they don't like each other, okay? Once you've enrolled in Medicare Part A, any HSA contributions made by you or the employer will become taxable, okay? So you lose those tax advantages. After a full calendar year, so if you have for a full calendar year had Part A and been contributing to the HSA, whether it's your money or your employer money, you would pay tax on those dollars at your ordinary income rate, and you would pay a 6% penalty on that money. Okay, so it does have to happen for an entire calendar year. Do keep in mind, if you have not elected to take Social Security, you do not have to pick up Part A. So if you are still working, you are with an employer with more than 20 employees, you do not have to take Part A. However, if you go ahead and start taking Social Security, then you must pick up Part A. Okay. I find this scenario most common with, say, a spouse who's retired and they're still on an employer health plan through their spouse. Well, they maybe have Part A because of taking Social Security. It doesn't mean that they have to move to Medicare if the employer has more than 20 employees. Just understand any implications if they are on a plan that is a high deductible with HSA contributions. Okay, so it doesn't mean that individual cannot be on that high deductible plan, but that couple would have to keep their contributions down to an individual limit. Okay, so keep in mind, Part A and HSA do not go together. You'll be losing your tax advantages if you're trying to still contribute money into that account once you have Part A. Okay. You also need to be aware that Part A is backdated up to 6 months if you enroll to start your Medicare benefits and you are over age 65. Now, they don't backdate it prior to age 65, and you can contribute HSA clear up until then, and they will prorate amounts that you can contribute for that year, okay? But if you go to retire at the end of a calendar year, and you are, let's say, 67, they will end up backdating your Part A if you have not picked it up yet. Okay. So this is where the HSA, we do spend a lot of time trying to help people calculate, what are their prorated amounts that they can contribute without then paying tax on them. And remember, if you have that Part A and you're contributing for a full year, you would pay a 6% penalty. Okay. All right. Let's move forward then. I make sure that I pause a moment for questions. I am trying to pay attention here to the Q&A and the chat. I'm going to refresh them to make sure if anything else is showing up. I think we're good here. Okay, well, we'll move right along so I don't take up your entire lunch hour. Okay, when can you sign up? Let's first talk about turning 65. You have a window of time called the IEP. That stands for Initial Enrollment Period. It is the month of your birthday, 3 months before, and 3 months after. During this time period, you do not have to prove that you've had any other coverage from any other source. You just simply can sign up to start your Medicare A and your Medicare B if you would like. Okay, so we're going to say here, this is the first month that you're eligible. You are always eligible the first of the month that you turn 65. So if your birthday is September 10th, you are eligible September 1st to start your Medicare. Okay. Likewise, you need to know if you're lucky enough to have your birthday on the first day of a month, you will be eligible 1 month early. So if in that example, the person's birthday was September 1st, then their first month of eligibility is August 1st. So that would apply here to the E column. Okay. So let's go back to the September 10th birthday. Eligible September 1 to start benefits. So they can enroll to start Part A and B both starting in June. So this would be June, July, August, or I'm sorry, I said that wrong here. So June, July, August, they would start September 1. So they can go through that process with Social Security. Everything starts September 1. If, let's say that person is going to retire in November, so 2 months later, they want to start their Part B and they don't want to be paying Part B premium until November, then they would wait until October to do the application for Part B. But in this type of scenario, I always suggest the person use these 3 months prior to the month of their birthday to enroll in Part A because of the fact that that will get the Medicare number issued and it will make it much easier when you're transitioning. Okay. So anytime a person enrolls within 3 months after the birthday month, Part B starts the following month. So keep this in mind if you're not wanting to pay that $202.90 before your retirement date. Okay. Now, let's say you get to 4 months after your birthday and you're going to wait even longer. So maybe you're waiting until full retirement age 67. So at retirement over 65, you also have a window that will open up 3 months prior to your desired effective date. And what I mean by desired effective date, it would be your desired Part B date. Okay. You need to speak with your employer. You have 8 months after the last day you have employer coverage to pick up Part B, and you wouldn't worry about a penalty. But keep in mind, there is a Part D penalty that I'm going to go over, okay? That you have to have qualifying drug coverage within 2 months of leaving employer coverage, okay? Now you need to speak with your employer and find out when will your coverage end if your last day of work is a certain day of the month. If you end work on the 15th day of the month, does your coverage end on the 15th or does it end on the last day of the month? Because Part B can only begin on the first day of a month, and you can overlap A and B with the employer plan. Okay. So keep this in mind. Your Part B is what will trigger your enrollment or eligibility for other coverage. B can overlap with the employer plan just like Part A can. Okay, so you have a window of time here to get enrolled without penalty. But if you want to make sure that you don't lack coverage along the way, it's important for you to understand your timeline. So in this scenario, the person has confirmed May 31st, they will be losing their benefits through their work. They want to start Part B June 1st. So their window to enroll will open on March 1st. Okay. Now, there are extra forms. Anytime someone is eligible for Medicare over the age of 65, they've been on an employer plan, the employer must complete what's called an employer verification form. It's an L564 form offered through Social Security, and they have to pick up a Part B enrollment form. Okay. So that employer form in this scenario, I would advise people have the employer, have human resources complete it in February so that you are ready to go to submit it in March. Okay. Especially if you've been on a plan where you're contributing to the HSA and you don't have a Medicare number yet. You will need this entire 3 months to get that Medicare number. I mean, they say they come out in 3 to 4 weeks. Sometimes that happens and sometimes it doesn't. So plan accordingly, okay? Um, this form, we do have access to that form. We're happy to share it with you. Keep in mind that is something then you will, once it's submitted, have to keep track of and make sure that Social Security is processing it. Squeaky wheel gets the oil on a car. The squeaky person will get their application processed in this scenario. So definitely something you must pay attention to and be tracking. Okay, we'll give you some advice, some tips, but we don't work for Social Security and we don't have any inside tracks to getting the paperwork processed. Okay. The Part B enrollment form, if you have a Medicare number, you would complete that. If you do not yet, then you have to take steps to enroll in A and B both and submit the employer form. Okay. So it's important, talk to your employer. If you're going to work beyond 65, and then now you want to set a retirement date, make sure you know when your coverage will end so that coverage can be continuous for you. Okay. All right. We're going to talk about your options. The goal here would be to make sure you have a good idea of what it will cost you when you decide to move to Medicare. So when you are losing that employer coverage, what is it going to cost you? We've already mentioned the 202.90. That is something everyone will pay unless you happen to have Medicaid benefits that take care of it. So most people pay 202.90 or possibly a higher amount if they had higher income. Okay, so we're going to talk about supplement in Part D and Medicare Advantage plans that help pay portions that Medicare doesn't pick up, or they create a cap to what you would have to be responsible for. Our first look is really going to be these plans at a glance. What are the pros and cons for each type of coverage? Because there is no wrong answer for coverage. It's just how do you like to be covered? So option one, Medicare Supplement Part D, these are going to have higher premiums for you, but they're going to have less out of pocket as you need care. The most popular plans that we see are GN and high deductible G. They are standardized by the government. Every insurance carrier who offers a G offers you the same benefits. Okay. These are the plans that have the best value in most states. They do allow you to see any doctor that takes Medicare. So you don't have to worry about a network. People describe them as being predictable and flexible. Some of them will have perks like gym or maybe vision benefits for glasses. Okay. You do have a guaranteed enrollment period for 6 months. So from your Part B date, you can enroll in the 3 months prior once you've applied to start Part B, and your supplement can start the same date as your Part B, or you can enroll within 6 months of that Part B date. If you do not enroll within 6 months, you will be required to answer medical questions to qualify for that supplement. There's not an annual enrollment period to enter into a Medicare supplement plan. Okay. Now, you also would add a Part D plan to that to cover medications. Okay. Now, option two, this is Medicare Advantage. This would be Part C of Medicare. Part C and D came about in 2006 to layer on options for coverage, mostly due to drug coverage and covering medications. Advantage plans will be lower premium, so there's no premium on most of these plans, but they will have higher out-of-pocket for your medical care. They are only required to take over paying what original Medicare pays, but they do not pay the out-of-pocket you are responsible for. They just reschedule out how the copays and coinsurance are taken care of. So you're going to have more out of pocket, but a low premium. Most of these plans have gym memberships. Many will have dental, vision, hearing benefits with them. We used to see a lot of over-the-counter cards. So that would be money that you could get the pharmacy to buy vitamins or Tylenol, Advil, other health-related items. Not all plans have all of these benefits, so you have to determine what's most important to you. The biggest thing here is that with most of these, they will wrap in your drug coverage and then have a network of doctors that you have access to. And the networks might be based off of a health maintenance organization or preferred provider organization program. There are more prior authorizations for these. So they're just trying to make sure, are you doing everything to contain the cost under your Medicare option? Okay. So kind of high level here, pros and cons for you. We're going to get into more specifics first on option 1. So this is where we have alphabet soup, okay? I mentioned guaranteed opportunity to pick these up within 6 months of Part B. If you are born prior to 1955, you can get into any of these plans. But if you're born 1955 or later, C and F have gone away. The most popular plans and the best value currently is a G, N, or this G star that stands for high deductible G. Okay. Now, if you said, I want the most coverage possible, I want my life easy, you're going to take G. G covers everything but the Part B deductible, which is currently $283. Your N is very similar, covers everything at the hospital. You still pay the deductible of $283. You do have some co-pays for primary doctor visits or emergency room visits if they're not ending in an admitted stay. And you could face excess charges if you ever see a doctor that does not contract to take Medicare, but they agree to file the claim and it's for something Medicare will cover. So these are very rare excess charges, but they are possible. And then we also have a G high deductible plan that you pay the first $29.50 in claims, and then everything is covered. So those are really the top 3 that we see. Again, you have 6 months to pick these up without any questions. Now, beyond that, if you had never picked up a plan, you would have to answer medical questions if you want entry into a supplement. But if you get into a Medicare supplement and you want to switch your insurance carrier, there is a new birthday law in Indiana. Other states have offered the birthday law or do offer it. Others have filed to offer it in the future, okay? So right now I'm going to specifically be speaking about Indiana. So this birthday law would allow you to switch your insurance carrier from the day of your birthday for up to 60 days after. Okay, so what I mean by that is, let's say you take G and you take it with ABC insurance carrier, and you decide a few years later, well, I'm happy with my coverage, but the premium has gone up, which they all go up every year, okay? But now you want to change to XYZ company. You are guaranteed the ability to do that as long as you are in an active plan, you're paying premium, and you have to be able to prove that, by the way. But you could switch from ABC company to XYZ company with Plan G. You can't switch from G to N, okay? So the annual enrollment period that you see all the commercials about does not apply to any of these alphabet soup options, okay? That would be the birthday law, which would be from your birthday for 60 days following, okay? So something to keep in mind. If you're really thinking that you want an option that provides more predictability and flexibility, you would want to look at Medicare supplements, also known as Medigap plans, by the way. Okay. Now, if you do go this direction, you have to pick up a standalone drug plan. With the prescription drug plans, they are required to cover FDA-approved medications that you pick up at the pharmacy. As I mentioned before, and what's covered under Part B, chemotherapy, immunotherapy, infusions, anything administered in the doctor's office would be covered under your Part B benefit, okay? So not under your drug plan. Medications that you take, they will be impact your best drug plan for you. So will the pharmacy that you use. So we use a tool on Medicare.gov. It compares all of the plans, puts them in the best order so that you know what's the best plan for me. How do I save the most money on my prescription drug plan? These do change every year. So in September, you receive an annual notice of change. You need to open that up because your premium may change. Your copays, depending on what tier your medication is, may change. So you need to pay attention to your ANOC. You also need to know there is a potential penalty that can occur if you do not pick up qualifying drug coverage once you are eligible for Medicare, okay? So once you turn 65, if you say, I'm not taking medications, I don't want to pay a premium for a drug plan, just know that later on you would face a penalty, okay? So I'll get a little more into how that penalty works in a few slides, but I just wanted to mention that here. All right, I'm not seeing any questions yet. If there is, I'll try to stop again in a little bit. This is where I want to show you premiums for option one. Option one examples, these will be priced differently for male, female, depends on your age, your tobacco use status. Those all affect your premium. So the example on the left is a Plan G. That's going to be your most expensive option, okay? It's one of the more popular plans. You're going to pay your Part B. I have the average Part D premium in here. And then your Plan G average for a male age 65, okay? And I am in Indiana, so I'm showing you Indiana rates, okay? So high premium, low out of pocket. This is all you would have out of your pocket for medical care. And then your medication costs just depend on what you're stating. Okay. All right. I do have someone who wants to ask a question. If you would like to, feel free just to put that in the chat if your Q&A is not working. Okay. So feel free just to put it in the chat. That will be fine. Thank you. All right. The plan on the right. This is a high deductible G. You would pay the first $29.50. You still get to see any doctor that takes Medicare with the high deductible or the traditional G. And know that a plan N is in the middle, a little closer to a G premium, because N covers everything if you're hospitalized. Okay. So this is just trying to give you some examples of what to expect. And if you are trying to compare, let's say you're still on an employer plan, but you know you want to have the most predictable coverage, you would just weigh this amount against what you're paying for your employer coverage. Okay. So this is option one. Option two, Medicare Advantage plans. These are Part C of Medicare. Private insurance carriers take over paying what original Medicare would pay. Okay. Many of the carriers offer plans under both Part C and supplements. Okay. But private insurance companies take over paying what original Medicare A and B would pay. Now, you do have to be enrolled in A and B. You do have to pay the Part B premium to be on a Medicare Advantage plan. So again, they are required to pay what original Medicare pays, but they do not pay your portion. They will reschedule out the copays and co-insurance. You will pay that up to a maximum out-of-pocket limit. And they will have a network of doctors that you need to stay within in order to save the most out of your pocket, in order to have lower copays or co-insurance. Again, many of the plans are on health maintenance organizations, in-network benefits only. We do still have a few plans that are PPO, preferred provider organization, so you can see any doctor. But I will tell you the PPO plans are dwindling away. We're really seeing a push towards HMOs. These change every year. You need to look at your annual notice of change. Okay, so if you are happy with your coverage, everything always rolls over year after year. But you want to pay attention to see if the premium has changed or co-pays have changed, that type of thing. Most of these plans have dental, vision, some hearing, you might have gym memberships or over-the-counter dollars, okay? So they're all about, oops, my apologies, they are all about perks on these plans, okay? All right, and I'm going to finish this section, then I'm going to address the Part D penalty and address the question that has been proposed. Okay, so the option 2 examples, premiums are the same for males and females. Doesn't matter if you're 65 or 85 or a smoker or a non-smoker. These are dependent on what county you live in. So the zip code and the county you reside in will determine what plans you are eligible for. Even if you receive your care in another county, you cannot enroll in a plan in that county. It must be where you reside, where Social Security has your residence address. Okay. Now, these premiums you will see they are much lower. Most plans now are $0. If you see a plan that has two different out-of-pocket maximum limits, that's normally a PPO style plan. So you can go to any doctor, but if you go out of network, you have a higher responsibility for out-of-pocket. Here, more of an HMO style, a lower responsibility. And then your medication copays, it could just depend on, what you're taking, what pharmacy you use. Okay. But option 2, the drug plan gets enrolled right in through that Advantage plan. There are a few plans that do not have drug coverage, but they're intended for people who use the VA system for medications. So the veterans programs. All right, so option 1, option 2, if you're trying to compare to work, just know if you're moving to Medicare in general, you'll spend somewhere $202 up to $418 a month, depending on how you want to be covered. Okay. All right. I want to talk about the Part D penalty. And that is where if you do not have qualifying coverage from the time you are age 65, you will incur a penalty. Okay. So this could also be if you're Medicare eligible by reason of disability. So they want to make sure that your drug coverage that you have pays as well as a Medicare standalone drug plan. Okay. Most employer plans do cover medications as well as a standalone drug plan. However, moving into 2026, I have been contacted by some groups that do not have creditable coverage any longer. So know that if your coverage at work is not creditable and you turn 65 and you're not retiring for a year, you will be subject to a Part D penalty. Okay. So that penalty, you have to get enrolled in drug coverage within 63 days of losing the employer plan, okay, or of turning 65. They'll take 1% of the national average price of a drug plan, so 1% of 38.99, so 0.3899, and they will take that times the number of months that you went without creditable drug coverage. Okay. Now that penalty is charged when you enroll in a Part D plan or a Medicare Advantage plan with Part D. So let's say you retire, you don't pick up drug coverage for 2 years, and now, you're like, well, I'm taking medications, I'm going to enroll in a plan, 24 months times 0.389. So you're going to be paying a penalty for those 24 months that you did not have coverage, and it will kick in once you enroll. Okay. Make sure you ask your employer for a creditable coverage notice. So if you are still on an employer plan and you are turning 65 or already eligible, make sure you confirm if your plan is credible or not. Okay, so it just simply means, do they cover medications as well as a standalone drug plan under Medicare? Okay, so be aware it can add up. It just really depends on your circumstance if it would be, if it would make any sense to accept that penalty. Okay, I want to go ahead and answer this question. Okay, so an individual turning 68 this coming March, okay, but planning to continue to work until age 69. They do want to start Social Security this year, however. So if you start Social Security, what you need to know is that your Part A will be automatic. They will backdate it 6 months from the month that you process your enrollment. Okay. So let's say they want to start Social Security in September. And then they go to do that. They work ahead of time. It's in July. They're going to backdate that Part A 6 months prior to July. Okay. So the question then is also, they stop contributing to the HSA at the end of December, but the employer still has to contribute to the HSA. Okay, so they can't necessarily class you out just because you're picking up Part A. That's okay. You can still get the employer contributions. You won't get the tax advantages on that money. You may even have to pay a penalty if you continue to work and be on that employer plan. But you are only paying a penalty on that employer contribution amount. You definitely want to stop your own HSA contributions. Okay? So, it's good if you can stop your own contributions. Normally, employers will allow you to do that, to stop them at any time, but they may have rules around, you have to stop them 30 days in advance just because it gives them time to process that. If you did happen to contribute yourself, you're not going to jail. No one is going to jail. However, you will pay tax on any money contributed, so you lose the tax advantages. And if you contribute and happen to have Part A for the whole year, you'll pay that 6% penalty. Okay. So I think I've addressed that question. I'll come back and check here in a minute if there's anything following up with that. All right. So we'll try to get everybody out so they can have a little of their own lunch hour. I want to talk about annual enrollment period. This will not apply until after you have moved to Medicare. So if you're retiring at the end of a calendar year, AEP still does not apply to you. It only applies once you are already on Medicare, and it allows you to make changes to Part C or Part D. So you can enroll in a prescription drug plan for the very first time if you've never picked one up. You can switch from one drug plan to another plan. You can enroll in a Medicare Advantage plan, a Part C plan for the first time. And you can switch from one Medicare Advantage plan to another. Okay. So AEP, annual enrollment period, that they advertise all the time, October through December, that only applies to Part C and D once you're already on Medicare. It does not give you an opportunity to get into a supplement or Medigap plan for the first time or make a change to that plan. It is only C or D. Okay. So if you didn't choose a drug plan, you had retired, this is the time frame you would want to pick one up. Okay. So AEP applies to Part C and Part D. All right, next step. So if you're turning 65, sign up for your Part A and B if you no longer have employer coverage. Or you need to determine your retirement date. Ask Human Resources, when will your last day of coverage be? Will your coverage end on the middle of the month or on the last day of the month? Okay. And then you apply for your A and B through the Social Security office. again, I would encourage all of you to go ahead and set up an SSA.gov account, even if you don't plan to retire for a couple more years. Okay? So just be aware of that. Oops. Now, how do we help you? So at Henriette Group, which we are now part of Hub International, we are licensed and certified advisors. So we have a team of people to help educate you on all aspects about Medicare, help you navigate through your transition, understand which philosophy suits you best, okay? We do work as independent agents, so we're not tied to any one insurance carrier. Our goal is first and foremost to help you figure out which philosophy and then which insurance carrier will help you get to your end goal for coverage and how you want to be covered. So we'll assist with reviewing your coverage options that are tailored to you. Make sure year after year they're meeting your goals, okay? We will facilitate enrollment for full coverage. So year after year, if someone is in, whatever Medicare plan you're in, they will always roll over. You do not have to re-enroll every year, but you always want to be opening your mail, paying attention to any changes, because Part C and D, they will change. Premiums may adjust, copays may adjust. You need to pay attention. So if you're in an Advantage plan and you decide, I'm not as happy with this plan anymore, or there's a benefit that I'm losing, that does anyone else offer it? That's when we would help make sure, is there a better option for the next year? Okay. Drug plans will help guide you on what you do to make your change for those. We will facilitate enrollment for full coverage when someone first retires, but we do not handle year-to-year drug plan changes. They have stopped paying us to do those, and we simply can't spend that amount of time on those in the fourth quarter. Okay. But we are still your resource after you've transitioned to Medicare. So we're here to answer questions. We do send out quarterly newsletters. They go out electronically to your email. And we have important updates on those newsletters. So it's important that you open them and you read them to catch up on any changes in the Medicare system. Okay, so that's what we do to help people. As I mentioned before, we have a team of individuals here. Here's our contact information. So if you have questions, just reach out to us. This information goes to all of us. This is a texting feature that you would have to reply yes for HIPAA compliance to. But we all have availability at this contact information. I do have an extra note while any of you are jotting down the contact information. So I have an extra note on this scenario that maybe this will help others here. So this individual was able to stop HSA contributions, just could not stop the employee portion because of still working and had not filed for Social Security as of yet. So that is great. You've done everything correct there. Again, your employer generally always has to continue contributing because they can't class you out, okay? And that's okay. Let's say they contribute $1,000 and you still end up having to pay some income tax on those and maybe even the 6% penalty. You will still hopefully net, say, 700 out of it at the end of the year. So it's still money that is in your pocket, still money you can use towards qualified medical claims. That's perfectly fine. There just is no reason to continue your own contributions because the 6% penalty specifically, you wouldn't want to be paying that extra money. Okay, so it sounds like everything is great with that scenario. Hopefully that story helped a few others of you. But I think you're in great shape there. Okay, looks like maybe I have another question coming in. No, but thank you. You are welcome. Hope everyone found this helpful. We do provide these webinars quarterly. We do have a couple seminars coming up in April and August at both our West Lafayette and Indianapolis locations. So we are Happy to help you. Okay. I'll give it another moment, see if there are any other questions, and otherwise, hopefully you can have a little bit of your lunchtime back if you're trying to join us on the lunch hour. You are welcome. Okay. I don't see any more questions. Again, if any populate, go ahead and feel free to email them to the Medicare at Henrietta or text us or give us a call. We're happy to help.